Connective tissue work goes by many names in the massage profession. I prefer to think of this as working with tissues at bind. We're attempting to increase the pliability of the connective tissue structures. Fascia is one type of connective tissue. Fascia's main role is to separate and bind areas of the body together. Being demonstrated now is using mechanical force to shear one layer of muscle off of the other. Assessment indicates where the tissues are stuck. Comparing one side against the other allows us to identify where areas are not functioning normally. Once the binding area is identified, tension force is primarily used, as is shear force, bend force, and torsion force. The key to working with connective tissue is to work at the bind and hold just past the bind. And then always reassess to identify changes. Again, assessment always occurs first, identifying areas of tissue bind. Skin roll can also be used to assess for connective tissue restriction. Comparing the amount of skin that can be lifted is an excellent assessment process. Again, identify the area of bind or restriction. Begin with a tension force into the area, staying at and just past bind. Hold the tension force into the tissues. It is important that drag is used, so lubricant use is reduced significantly. Reassess, and then apply another mechanical force. In this instance, we're using a bend force. Again, reassess. The area of the connective tissue dysfunction will start to get red. This is a histamine response and helps you identify where the area is binding. Shear is now being utilized to address a more specific area of the connective tissue bind.